Hi everyone, I'm Dr. Nina Campagna and I'm here today to share with you information about optimizing outcomes for regenerative medicine therapies like PRP or stem cell injection therapies. I am a naturopathic medical doctor and I am practicing here at Ego Wellness. So let's go ahead and dive right in. A little bit about nutrition and regenerative medicine, just high level here. So the foods and the drinks that we consume each day truly are the building blocks that we use to function or dysfunction, that our bodies use really to function or dysfunction. And therefore, we can improve our nutrition, improve what we're eating so that it really serves us and gives our bodies those helpful building blocks that the body needs to recover, to heal, to decrease inflammation and optimize your outcomes. So when we're eating unhealthy foods, on the contrary, the body's going to experience inflammation and therefore more pain, and we're going to have difficulty healing, reduced or increased healing times, and just poor tissue regeneration. So as you can see, we want to optimize nutrition so that you get the best out of the therapy that you engage in. So what are some of the foods to optimize outcomes? The first one is protein. And it's really important that we talk here about the differences in proteins because certain types of protein is going to be better than others. So first, I'm going to speak to you about animal protein. Examples of animal protein would be beef, bison, elk, chicken, turkey, fish, any type of seafood. Eggs count as well. And you want to make sure that you are consuming about the size, if you can see this here, about the size of the palm of your hand for a female, and this is an estimate, or about a palm and a half size for a male 3 times a day so that you are getting in an adequate amount of protein. If you want an equation, if you're a numbers kind of person, you can write this down or see on the slides that it's roughly 0.75 grams to 1 gram per pound of ideal body weight. So for example, a 160-pound person, how much animal protein should they be eating in grams? They should be consuming, if it's going to be about 75% to 100% of 160 pounds, that's about 120 to 160 grams of animal protein, again, to give them enough of that protein intake that is so important. So you're probably thinking, well, why is Dr. Nina here talking about animal protein? What about soy protein? What about just eating, pea protein or these other types of protein sources, quinoa and things like that? There really is a huge difference between plant protein and animal protein. And the difference, we're going to keep it high level here, but what makes up a protein are called amino acids. So you can think of amino acids as the building blocks that make up a total protein. And plant proteins aren't as helpful to the body because they don't contain all 22 amino acids, whereas animal proteins do contain all 22 amino acids. Now, a lot of people will say, well, I can take different plant proteins like beans and rice and put them together and create a complete protein that has all 22 of those amino acids. Yes, that's true, but you would need to eat, say, about 5 cups of rice and beans for the same amount of protein with that complete 22 amino acid profile in 1 chicken breast. So we start to run into a lot of other issues when we're consuming high amounts of plant-based proteins, which is another topic for another day. But stick with me here, and if you want the best outcomes, aim for animal protein, palm size, palm and a half size each meal. If you are someone who is, just very adamant that a vegetarian or vegan lifestyle is the route for you, and there is an option, and that would be to go ahead and take organic, ideally sprouted, non-GMO tofu and have that 3 times a day. Now there can be things that potential consequences from eating excessive soy, but if you're someone that again needs an alternative, go ahead and have, again, about that same block size of palm size of the tofu and combine it with a supplement which is called branched chain amino acids. And if that's something that you're more curious about, that is something that I can help to advise on individually. So we've just talked about protein and how important that is. There's also the importance of what are called dietary fats, or just fats in general. Sometimes people will call them fatty acids, but we'll stick with fatty acids for now. So omega-3 fatty acids, they are shown to be the most beneficial for lowering inflammation and expediting your recovery. Examples, some really great examples of omega-3 fatty acids are going to be things like cold water fish, especially wild salmon, also walnuts, avocados. These are really good high omega-3 fatty acid foods. Foods that are, or fatty acids that are more likely to actually stimulate inflammation and impede your recovery process and cause you more pain are going to be those that come from more grain-based foods. So we're thinking things like breads, pastas, rice, tortillas, cereals. These are really high in omega-6 fatty acids, and like I said, they stimulate more inflammation, pain, impede recovery. So big picture take-home point here is eat more omega-3 rich foods and really work on minimizing those omega-6 rich foods. All right, something else to pay attention to when it comes to nutrition and optimizing your outcomes for regenerative medicine. Sugar and sweets. I know nobody likes to talk about this topic, neither do I, but it's something that we should consider if we want to have the best outcomes when we're getting our therapies and when we are wanting to feel good in our bodies and not have pain. So let's go ahead and dive in. Sugar, unfortunately, it's one of the top foods that causes both an inflammation in the muscles and as well as in the joints. And we know inflammation leads to degeneration of the tissue, which leads to pain. Also, inflammation leads to poor wound healing response times. So sugar, not so great. Processed sugars, and I may be saying this again in a different way, but just to drive the point home, the processed sugars, they release pro-inflammatory substances in the body, which is further causing inflammation and degeneration of the joints, tendons, and ligaments. Okay, so sugar has many names, and that's where it can get kind of tricky because we often could read a label and we don't see sugar spelled out, and so we think, okay, this is a good choice, and we don't know that actually there's some other names that are truly sugar, and it's just being a bit sneaky on the label. So you want to look out for not only sugar, but cane sugar, fructose, crystalline fructose, corn syrup, high fructose corn syrup, brown sugar, and agave. I know a lot of people hear agave, that's something I should be having, but in fact, it will lead to more inflammation. So if you want to have something that's sweet, or you want something to add to your coffee or your tea, or you're creating an almond flour, banana bread instead of a grain-based, wheat flour banana bread, and you want some sort of sweetener to use things like raw honey, grade B maple syrup, blackstrap molasses, coconut nectar, stevia, monk fruit, erythritol, xylitol, allulose. These are all alternatives to traditional sugar or some of the aforementioned names, which will not cause inflammation in the body and will still give you the sweet flavor that you're looking for. Keep in mind, there are sugar substitutes. There's a lot of things that will say 0 sugar or diet, diet soda or whatever it may be, or sugar-free. And then when we read the label, it has these sugar substitutes that are made from chemicals and actually still cause inflammation. So do watch out for on labels, and make sure to try to avoid if it says Splenda, which is actually actually sucralose, or Equal, which is actually aspartame, or something called acesulfame potassium. So those are just ones to look out for as well. Another one that some folks don't like to talk about, I know, but we have to, it's alcohol. So there are some options, but ideally overarching here, what we want to take home is that less to none is better. And so alcohol is also known as ethanol. Truly, it is a toxin to the body, and it causes damage to the tissues, and it stimulates inflammation. And as I'm probably sounding like a broken record now, inflammation stalls healing, it increases pain. We don't want that, right? So while omitting alcohol is ideal, I recognize this isn't realistic for everybody all the time. So if you are able to avoid certain types of alcohol all the time, those would be beer, sweet or sugary drinks or cocktails. If you're going to use mixers, if there's soda mixers or juice-based mixers, those are not going to be so great. Sparkling wine also is higher in sugar, so not good. If you are going to go ahead and indulge, there's some options for you. So I would say stick to clear spirits, gin, tequila, vodka, and go ahead and mix them. You could have it on the rocks, or you could have it with club soda or a mineral water like Pellegrino or Perrier, but not tonic water. Tonic water actually does have sugar in it. So feel free to add some lime or lemon to it so you can have a little bit of flavor. If you want to throw in a couple of fresh berries in there, that would be fine. But again, we're avoiding the sweet mixers, the juices, that type of thing when we make our cocktail. If you really want to have wine, go ahead and have a dry, unsweet red or white wine. And keep in mind, ideally we're going to have, if we're female, it's a 1 drink maximum. Males, what we find is their bodies are able to tolerate 2 drinks with less of an inflammatory response. And that would be, as far as the drink alcohol recommendations, that would be per day. So 1 for women, 2 for men maximum. And also keeping in mind that while we're trying to minimize alcohol consumption, that we don't want to be drinking every single day. So if you can keep it down to 1, having it maybe twice a week would be a goal to set, twice or less. Okay, so the next topic we have for the next slide here is hydration and healing, and just how important it is to be hydrated. That means keeping your water levels up when it comes to healing. So roughly 60% of our bodies are made up of water. And I say that because I think it helps to understand just how important it is to make sure that you're drinking plenty of water. We've got to keep that 60% of water in the body, and you can only get that by drinking it, unless you're going to be hooked up to an IV all day long. All right, so water, it does fight inflammation, and it acts as a lubricant for the joint. More lubrication means less pain. Oftentimes when we have that more, bone on bone or closer to bone on bone situation happening, we're having less lubrication, more pain. If we can add fluid in there, adding water in there, we're adding space, and that is going to help for you to have less pain. So dehydration causes the body to look for water in other areas. So if we're not drinking enough water, the body looks for other areas in the body to pull it from. So the body will start to pull water from, say, the joints and redistribute it to other areas where it's really needed, say up in the brain or to the heart. The joints, as far as the body goes, the body doesn't consider the joints very important. So that's something to keep in mind. And also that taking water from your joints, then by not having enough water there, it allows for toxins can sit within the joint and remain there, which without instead being flushed out. And when they remain there, they then fuel inflammation and pain. So goal for hydration, if you're looking, for an equation here, how much water should I be drinking? I get that question all the time. Ideally, we want to drink at least half of our body weight in ounces every day. So let's say that there is a 180-pound person. They should be drinking at least half of their body weight in ounces. Half of 180 is 90, so that person should be drinking at least 90 ounces of water every day. This ideally also should be filtered water. That's to take out a lot of the toxins, things like different pollutants that end up in our water, whether it's from medications that have been flushed down the toilet, or from residue runoff, or from things in the air that have then gone into our water system. So when it comes to water, another thing to keep in mind is that things like coffee or iced teas or sodas or other beverages do not count towards your water quota for the day. Really just pure filtered water. If you're going to have sparkling water, that's fine, but it should be a mineral water. So something, a Pellegrino again, or Perrier would be fine, but a lot of just those canned sparkling waters, they don't have the minerals added back in and they don't end up counting towards your water quota. We're moving away from nutrition now, and we're going to move on to supplements that can support healing and decrease pain. So I've got 6 of them for you here. These are the top 6 that I recommend for folks who are having either pain and or inflammation and or are going to be having regenerative medicine treatment. So whether it's PRP injection or a stem cell injection. The first one is called theracumin, and theracumin is concentrated and highly absorbable. It's a concentrated, highly absorbable form of turmeric. So I'm sure many of you have heard of turmeric. It's a orange root, and it is very, very potent when it comes to being anti-inflammatory. It actually works in the body much like some of the pain medications like ibuprofen and Tylenol and Aleve. It's just that it doesn't have any of the side effects on the liver or the kidneys that those medications do. Also, the theracumin that we offer is very condensed and highly potent. So you would have to eat tons of turmeric all day long and probably end up with orange teeth in order to get a sufficient dose if you were to do it in food form. The second supplement is a multi-collagen peptide. So collagen is a significant component of muscle, tendons, ligaments, and bone. So these are all aspects of your joints. And the peptide form of collagen is the most absorbable form by the body of collagen. So that's why I advocate for a collagen peptide rather than just collagen protein powder. And ideally you want to be consuming types 1, 2, 3, and 4 of the collagen peptides. A lot of peptide collagen powders or collagen peptide powders out there will only have some of the 1 and 3 or 2 and 4 or whatever the mixture may be. I do really recommend for best healing that you do have all types, 1, 2, 3, and 4. So the next supplement is magnesium glycinate, and there are many forms of magnesium, but in this scenario here, I'm advocating for magnesium glycinate. Magnesium helps to relax the tense muscles that often end up compensating when our bodies are injured or when the joint is injured. And then glycine helps to reduce inflammation. It also, and therefore the magnesium glycinate combination there is a highly absorbable form of magnesium. So just in case that wasn't clear, I'm going to go over magnesium glycinate once again. Magnesium does help to relax tense muscles that compensate when our bodies or our joints are injured. And then using the magnesium glycinate form is really important because glycine is what helps us, one of the things that helps when combined with magnesium to reduce inflammation. And magnesium glycinate, this form in particular, is a highly absorbable form of magnesium. So you'll see magnesium citrate and magnesium threonate and many different kinds of magnesium, but when it comes to your joints and pain and inflammation and muscle health and tendon health and all of the things that we're discussing today, magnesium glycinate is going to be the way to go. Okay, fourth of the 6 supplements is called Mitocor. Mitocor, it's a blend of many different vitamins, minerals, antioxidants that are synergistically formulated to support the body in regenerating new tissue. This blend, it also helps to fill in nutrient gaps that exist in your body because you're not getting all of the nutrition in that you need from your diet. And this is just completely normal with just about everybody, we by nature as humans tend to eat the same foods every day or every few days. And so we end up with certain nutrient deficiencies. The mitochondria in some aspects is similar to a multivitamin, though much more powerful and much more multifaceted. And so it does, like I said, fill in those gaps that you're not getting from your diet, in addition to helping to regenerate tissue. Next up, liposomal NMN. So NMN, it's the primary nutrients that is required for the production of energy at the cellular level. Our cells need optimized energy in order to allow for the body to repair. So our cells make up our tissues, and so we really need those cells producing as much energy as possible. And you can think of it like this. NMN is the food that is used by our cells, specifically the mitochondria within the cells, for any of the science folks out there. The mitochondria of the cell uses the NMN as food and then pops out cellular energy, okay? All right, next up, final supplement I'm recommending is called Orthomega. Orthomega, we were talking about fatty acids and how important they are. This is a very concentrated form of omega-3 fatty acids. And as I mentioned before, fatty acids, omega-3 fatty acids in particular, they're an essential fat required to lessen inflammation and pain. And why I love Orthomega in particular is that it is a fish oil, but many of the fish oils that are out there are actually full of heavy metals, or what are called dioxins or PCBs. These are different toxins that in fact end up causing more inflammation, more pain, more deterioration to the body. The Orthomega does not have any of those toxins in it, and so we don't have to worry about having any of those potential side effects. Also, it's highly concentrated, as I mentioned, and so you're not having to take gobs and gobs and gobs of fish oil or eat mounds and mounds and mounds of seafood if that's not something that you enjoy. The last topic we're going to talk about today is IV therapy. So IV nutrient therapy does have many benefits when it comes to a multitude of things in life, but especially when it comes to regenerative medicine procedures like the PRP injections and stem cell injections. So IV nutrient therapy, it allows for nutrients to be delivered to the body in high doses in an efficient amount of time. So an IV nutrient bag, we can put in very high doses of different nutrients in there, and then run the line into your vein and just administer an IV that takes an hour or less. And so rather than having to rely on so many supplements, while the supplements I recommended do offer some different benefits than the IV. The nice thing about IVs is that, again, it's so concentrated that you would likely have to take many more pills to get that high concentration, and we can expedite it happening, in under an hour. IVs allow for nutrients to be delivered without having to be absorbed by the GI tract. The GI tract, when we have to absorb nutrients like our supplements, some folks can have absorption issues where they're not absorbing their supplements very well. And so this is something I can help folks out with on a case-by-case basis, but for some people, IVs might be very helpful if they're not absorbing their nutrition, whether it's through their food or through their supplements, very well, because we bypass GI absorption, we go directly to the vein, and those nutrients are shunted directly into your body. IVs also provide hydration, a hydration benefit to the body. So most of us are dehydrated. When you come in, your IV bag is going to be in a hydration-rich solution. So you're just getting that added bonus of more hydration. And finally, IVs allowed for a wide variety of nutrients to be efficiently delivered at the same time. So kind of like what I was talking about initially on this topic, is that we can take many different kinds of nutrients and put them all in the bag rather than reaching for many different types of supplements. That said, the supplements that I did mention before, many of those nutrients you can't necessarily put into an IV bag. So in an ideal world, we're using some supplements and then we're using IV therapy to get the best outcomes. Our top nutrient IV for tissue healing and decreasing inflammation is what's called the Myers cocktail. And it's our most comprehensive blend of vitamins, minerals, and amino acids. There's tons of different nutrients in there, nutrients including vitamins, minerals, amino acids. I'm just using nutrients as an umbrella term. But some of the beneficial nutrients in that particular bag, the Myers IV bag, include B vitamins, which aid in muscle, tendon, ligament, and nerve health. Vitamin C, that's an essential cofactor for building collagen. And as we know, as your joints are recovering, you're needing new collagen there, or more collagen there. Zinc is in there, wards off inflammation. And magnesium is in there, relaxes tense muscles, which thereby reduces pain. There's also many, many, many more, and I'm not going to sit and read through them to you, but you can always get a full list from us here at the clinic. That is the final slide of the presentation today. We have covered a few different topics, including nutrition, supplementation, and IV nutrient recommendations to help optimize healing when you come in and as you're preparing for your stem cell treatment or your PRP treatment. If you do have any other questions, do feel free to reach out. I'm Dr. Nina Campagna, and I'm happy to consult with anyone one-on-one so that you can expedite your recovery time and make sure that you get the most out of your treatment. Thanks so much for joining us.